Our patient is an elite piano player that extensively uses their flexor digitorum profundus, flexor pollicis longus, extensor carpi ulnaris, extensor carpi radialis longus, extensor digitorum, dorsal interossei, which causes pain in the forearm, wrist, and fingers.
As the piano player is playing, these movements are occurring. So at the wrist, there's flexion and extension, and abduction as well as adduction. At the fingers, there's just abduction and then flexion and extension at the MCP joint. And then at the thumb, there's adduction and abduction.
To help our patient relieve the pain in the wrist and forearm area, one of the stretches that we will start with is having our patient have their arm fully extended with the opposite hand fully extend the wrist and then hyperextend the fingers back in order to stretch out the flexor group on the underside. In order to relieve pain on the extensor group side, we're going to have our patient go out and with their hand and then also resist the extension with the opposite. The stretch that we will have the patient do in order to relieve some tension is having both hands pushed together and forcefully pushing as hard as they can in order to put some extension on the wrist.
So for part of the strength program, the first exercise we're going to have the patient do is we're going to have them have a 3-pound weight out in front of them and do forearm curls, so extending and flexing the wrist to help work on strengthening those forearm muscles. So the next exercise that we're going to do in this strengthening program is we're going to have the patient extend their hands out in front of them and with a resistance band around both wrists, have them abduct and adduct the hands, so you're strengthening the wrist and forearm muscles. So if it is accessible to you, for our last exercise, we would recommend using a fingerboard because that's a very good exercise for you to strengthen your fingers as well as your forearm muscles. However, if that is not something that is available for you, then we would say to do ball squeezes. So having a ball out in your hand, extend the arm and squeeze the ball, and that again is strengthening the fingers as well as your forearm.